All right. Ah, that's why pala. Kaya pala. I thought it was my microphone. But anyway, can you guys hear me clearly now? All right, wonderful, wonderful. All right, so as I was saying, guys, um, staph aureus will produce an acidic environment around its colonies, and therefore it will ferment. Because of the fermentation of mannitol, it will produce yellow colonies. On the other hand, these two at the bottom, staph epidermidis and staph saprophyticus, will just produce pink colonies because they will not ferment mannitol. All right, clear, 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 clear. And all right, wonderful. Okay, wonderful. Now let's move on to the inhibiting. Yeah, we already answered that one. Inhibiting substance in MSA is your 7.5% NaCl, or basically just table salt. All right. Hence, we call it also health. Hence, we also call staph species as a halophilic organism. Now, let's go to the test to differentiate non-mannitol fermenting staph aureus species, because this is part of the workup. So okay, so we grew staph species already. So what now, sir? We don't have Vitek, we don't have BD Phoenix, who can help us out in identifying the organisms. Okay, so we're going to rely on traditional methods of identifying the organisms. What tests can we use to differentiate Staph epidermidis from Staph prophyticus? We need to use novobiosine test. All right. So novobiosine test, the results will be as follows. Staph epidermidis will be susceptible, and then Staph saprophyticus will be resistant. How do I remember this, guys? Please don't forget my mnemonics. Forget this mnemonic, sir. And when we talk about novo biosin, don't forget about sir and SSR. Okay? So that's the mnemonic that was given to me by a friend of mine when I was in college, because I always keep forgetting. Um, I always forget the mannitol fermentation, the non-mannitol fermenting staph species, their reaction, or their novobiosine reactions, or their results. So this is Staph epidermidis and Staph saprophyticus for you. All right, Staph epidermidis is susceptible. Staph saprophyticus is resistant. Okay. Now let's move on another one, on another test rather, to differentiate Staphylococcus from Streptococcus. Um, Usually it's confusing, especially if the person, sorry. All right, so usually it's difficult, especially if the medical technologist identifying the organism is a novice or an amateur, or somebody who has graduated and then immediately became, or somebody who is an intern, or somebody who is a fresh graduate, to differentiate beta hemolysis, because of the fact that sometimes staph species, although they have pinhead sizes, the appearance looks similar to Stafford Streptococcus. In the unexperienced eye, they both look the same. And one way to differentiate them is through the use of what test? We use it to clean wounds as well. The reagent that we use is to clean wounds. Can anybody answer? What's the answer? Can anybody answer me? What's the test used to differentiate staph and strep? It's not gram stain, all right? I'm just giving you guys, it's the biochemical test. It's not gram stain. Catalase test. All right. All right. Okay, okay. Who else? Does anybody want to contest the three girls who answered? What about Adrian, and what about Rainiel? Is catalase test also your answer? What about Mayra? What about Noreen? Catalase ka din. All right. So this is the biochemical test used to differentiate streptococcus and staphylococcus. All right, so everybody's answer is correct. However, there's another follow-up question. What reagent is used? Oh, yun, doon tayo nagkanda loko-loko. All right, so Joanna Baltar answered 3% hydrogen peroxide, hydrogen peroxide. Noreen also answered hydrogen peroxide. Does anybody want to contest or want to protest? Or they want to have a violent reaction? Nobody? Hydrogen peroxide also. Adrian also said hydrogen peroxide. All right, all right. Wonderful, wonderful. Students are agreeing at for once. Okay. So yes, all of you guys are answering correctly. All right, wonderful. Now, the positive result is what for catalase test? What's the positive result for catalase test? Bubble formation, bubble formation. All right. Present of bubbles. All right. Joanna said, all right, gas bubbles. All right. We can say that one. All right. So those are the again correct answers.